Hi everyone. I have been getting a lot of requests to do a class on what to study and how to study for the recently joined postgraduates in obstetrics and gynecology. So I finally decided to do a session, and this is the session is based on a lot of my own experiences, and it's been I did my post graduation in 2006 to 2009, so it's been about 13 years since I passed out, and that's a long time. But yes, those memories are very very fresh in my mind. So let's continue. So remember, as a postgraduate and now onwards after post graduation also, when it comes to learning, the sky is not the limit, it is just the beginning. All right, so there is so much knowledge, there's so much to learn. As a teacher, I am still I think I am 50% a teacher and 50% a learner, because I still learn every day. Every day I read something new. So the sky is not the limit. It is just the beginning. And always, always remember that there is no limit to education. There is no limit to knowledge. There is no limit to skills. You can always, always, always learn more. All right. Now, what are the different information sources that you have access to as a postgraduate? It is not like undergraduation where you just have your books and maybe the different platforms that are there for teaching. Okay, so as a postgraduate, you need, no one is going to come and tell you this is important or read this. You have to gather information yourself. Okay, and how do we gather that information? Primarily, of course, there are the books. Okay, nothing can replace the books. Now, I won't really, so there's so many books. If you go to the library, I won't really tell you which book for what are the books, because there's this unlimited number of books. For example, obstetrics. For obstetrics, Williams is the Bible. For gynecology, Novak's is the Bible. For operative surgery, Thielens is there. For reproductive endocrinology, Spiroff is there. But apart from these four main basic books, there are so many other books where different chapters are given differently. For example, there's a book called D-Swit for high risk pregnancy, and hypertension, diabetes are given very well there. Gabby, there's a book called Stephen Gabby Obstetrics where diabetes is given very nicely. So you will have to explore yourself. Of course, I am there to help you. You can always ask me which chapter to read from, where is it given best. But you have to, this is your own journey. You have to explore yourself, read as many books as possible from different places, and you'll get a better idea. Of course, the second source of information is, so I like to show off a bit, is the internet. And online education now has a very important role, especially after the pandemic. So, my channel is, of course, centered mainly on undergraduate teaching and NEET PG. But yes, if there is enough interest from postgraduates, many of my classes are for postgraduates also. But yes, I will be putting up lectures for PGs also. So you can keep having a look. And this is just, as I said, showing off my own me as a teacher. But yes, there are other online platforms, online sources available. There's so many journals you can access online. Okay, and many medical colleges have made, their library has made accessibility very easy. So there are a lot of places you can learn things from. So many people are posting their surgical skills on YouTube, on Facebook. um, there's so much you can learn from. So there's just no end to online education, but you again need to be very selective and need to identify what amount of time are you willing to spend on these online platforms. Because remember, as a postgraduate student, there's just so much to do in the hospital, in the wards, in the labor room, in the OT. There's just so much there. And then how much time do you really have? So that's very important. Okay, so majority of your teaching as a postgraduate, apart from these basic books, online platforms, journals, there is so much you can learn from the ward. Okay, from the patients, from the labor room. So patients are your main learning source. Okay, so nothing can beat experience. Okay, so evidence-based medicine, yes, it does. It is there. Evidence-based medicine is very important. But also, what is equally important is experience. What you get to see during labor room posting, during when you're taking your rounds in the ward, when you're interacting with patients. So always remember, patients are your primary source of learning. When you go to the operation theater, please look and learn, see and learn, see what's happening, look around. I always tell my students, question everything you see. Question every piece of equipment that you see, question every instrument that you see, question every drug that you see. Okay, so be inquisitive. All right, and yes, you may get scolded on. The surgeon might be very busy and you're asking your doubts, but it's all right. Okay, when the surgeon is free, ask them or ask the nurse, the sister. There's so many ways of learning, so many different things, how to maintain sterility, how to maintain asepsis, hand washing, different antiseptic solutions. So, the very basic things. These are things which no one is going to teach you. You have to learn by yourself, observe, ask, go back, read. Okay, so the smallest of things become very important. Okay, so as I said, patients are your primary people learning tools. um, so the OPD, the OT, the labor room, and whatever. For example, I put this up because I take a lot of classes on ultrasound also. So this is where you areas where you can learn. So I always ask my students to come and see ultrasounds and learn with me. So this is another area where you can learn. All right. Um, so patients are a lot. You can learn a lot from your area of work. It doesn't have to be the books, it doesn't have to be online or journals or all the time you're sitting in the library. No, you have to be out there. So every place, don't think that you have a 12-hour posting in the labor room, when will you study? No. So labor room is a place where you can learn so much. So as I said, it's very important to maintain a balance. Okay, so how do you balance your time? How do you manage your time? Don't get frustrated if you're on long hours on duty. Make the best of it. Try to understand that that is also where you can gather information, where you can learn. Okay, so learning, as I said, is not only knowledge; it is also skills and attitude. Okay, so now what does this mean? Okay, what does competence mean? Competence basically means that you are achieving a competence. Say you are learning how to suture and episiotomy. Okay, now for that it requires knowledge. Okay, you should be able to know the layers of an episiotomy. What have you cut? What suture material are you going to use? Okay, so it requires knowledge. It requires skills. Okay, skills. You have to, the more the number of episiotomy suture, the better you become at it. You should know how to suture it. You should know how to tie a knot, a basic surgical knot. So this is skills. Attitude, you should be able to communicate with the patient. You should be able to counsel her, explain to her, make her the procedure pain free. Okay, so she's just been through a delivery. She will be very anxious, she'll be very happy, she will have questions, but she'll also want you to explain to her what you're doing. So there's no point knowing how to suture an episiotomy, knowing everything about an episiotomy, if you are going to be rude to the patient. So just be respectful. The patient is helping you learn. So always remember, attitude amongst all these knowledge, skills, and attitude, all are equally important. Okay, you can't say attitude is just 10% of learning. No, it is 33%. Everything is 33%. So learning encompasses all three, and no one taught. So knowledge is taught, skills is taught, attitude. No one, at least in our time, no one taught us attitude. Attitude came from learning our seniors, learning the nurses, seeing people around us, how they were dealing with patients, and picking out what you felt was most appropriate. Or if you've ever been a patient in a hospital, you would understand how it is when you are in that situation. So attitude, communication skills are very important. Okay, there are many surgeons who are great for great surgical skill, but when it comes to talking to the patient, they don't even explain what's going to be done or how it's going to be done. So that leaves the patient very unsatisfied. So attitude, communication, ethics, all these are very important. Okay, so what does it to mean to be a good doctor? So the aim of doing post graduation, please don't remember that it's just the exam. So it's very important as a as once you do when you do a post graduation, don't just think that the end point is giving the exams and clearing the exams. No, the end point is that you have to become a good doctor. And what does it mean to be a good doctor? It means you have to be an excellent clinician. You have to be a team player. You should. There's no point having competition with your colleagues or thinking that oh no, you have to be better or you are better or you are not as good as your colleague. You have to be a team player. You should be able to talk to your staff nurse, talk to your the patient, talk to your fellow colleagues, your seniors, your juniors, your interns in your team, the housekeeping staff, all with humility, with dignity, and by and maintaining respect. Okay, so be a team player, be a leader. Eventually, you will be heading your team. So you should know how to lead your team. You should be an excellent communicator, as I have emphasized before. You have to be professional in whatever you do. You can't be very careless with your attitude and your behavior and how the way you dress up. So you have to be a thorough professional. That's what our job is. And learning doesn't stop once you finish your post graduation. No, okay. So believe when I say this, it's been 13 years since I finished, and I think I've learned much, much more in the last 13 years than when I did during my post graduation. So it's very, very important that this is not the end. You have to be ready to accept new knowledge when it comes. Okay, so now what are the tips from me to you? What are the tips? What would I suggest you? How do you become better at this, and how do you handle post graduation better or more easy without getting stressed, without letting your nerves get the better of you? So, suggestions number one, make a timetable for the month. Okay, there's a lot to do, there's a lot to cover in terms of studying. So try to make a timetable. You can make it for 3 months or 6 months or maybe 15 days or maybe for a week. Okay, a rough timetable would be for a month, and you know which topics you need to cover in that month. Okay, you can actually make a timetable for a month each for the next 6 months, because you would have your posting schedule. You would know when you have a labor room, when you'll be able to get, or when you're in the ward or the OPD, you will get more time as compared to the labor room. Put topics such that if you're in the labor room, you can put down all your labor topics, labor related topics, instruments, drugs, all that when you're in the labor room posting, so that you know you've seen something in the labor room, you've managed a case of shoulder dystocia, you can go back and read. Okay, so accordingly make things easier for you. In other words, make a daily schedule or a to-do list and try to complete it. So apart from the monthly timetable, when you get up every morning, okay, or before you go to bed every night, just write down what all needs to be done that day. Okay, you may or may not be able to complete it. You may be very tired at the end of the day, but if you have a list in mind, you may think, let me just finish one more thing. Let me finish reading about this, or let me finish learning about this, or watching this video or this surgical video on YouTube. So try to complete the list. Okay, but make a list every day. It's very, very, it helps tremendously. Learn from people around you, learn from your you they may not be actually teaching you like in undergraduate days, but indirectly you learn. So you learn from your seniors, learn from your colleagues, learn from your juniors also. There may be things which they would know and you don't, so don't think that they're too junior and I can't learn from them. No, everyone's experience is different. Medical education in India is very unstandardized. Okay, so you need to remember that wherever you get the chance, learn from them. Learn from the staff nurses. So many things they'll be able to teach you, okay, which you wouldn't otherwise learn. Okay, so most of the postgraduate institutes would have a facility for making a logbook, but if they don't, and even if they do, make your own logbook, okay, or improvise in the already existing logbook. So making a logbook helps in many ways. It boosts your confidence a lot. So if you've done 10 cases and you feel happy writing down what you've done, or if you've seen an interesting case in the ward, write it down. I continued making a logbook well past my post graduation, almost 3 years. Even after my post graduation, I was still making a logbook. I used to enjoy going through it and seeing, oh, I've done so much, oh, I've seen this interesting case. Okay, so it does help. It helps you in the long run once you're applying for senior residency or beyond that. Also, they'll ask you, what have you done? What interesting cases have you seen? If you have a record, it's always better. Okay. And small, small things matter. Dress up every day. Don't think that, oh no, another day in the labor room, oh no, another day of torture. No. So be happy when you go to work. Okay, this is your workplace now. This is going to be what you're going to be doing for the rest of your life. So dress up every day, smile a lot, smile with your patients. If you are happy, your patient is happy. Okay, when you're taking rounds in the ward, when you're seeing postnatal patients, you might be thinking, oh no, I've got postnatal ward duty today. Now we used to crib a lot, we won't learn anything there, and it's seeing just mothers and babies, but you can learn so much. You can to this date, whenever I go to the round and I um, pick up a newborn baby and cradle a newborn baby in my hands, that feeling of joy, nothing can beat that feeling. Okay, so smile a lot. If you are happy, your patient is happy, and you will make it through the day better by smiling than by cribbing the whole day. Okay, that's very important. Okay, so appreciate the little things in life, small gestures by the patients or small gestures by you towards the patient. Okay, so appreciate. If you are kind, the kindness passes on. Believe me, this is true. You must have seen lots of WhatsApp videos circulating. Kindness does pass on. So be a little kind, appreciate the little things, study hard. Yes, so don't I'm not saying, so you need to study hard, but you should also study smart. That means you shouldn't spend days and days and days on hypertension in pregnancy. You should know, okay, what is important, which books to read from. Okay, don't go into full research mode and just study one topic and then realize you've not done anything else the whole week. Okay, so study smart. Okay, and very importantly, many postgraduates, many students who cleared their NEET PG last year, they would call me up and say, "Okay, ma'am, we don't want to join this institute. There are no cutting chances. How many surgical chances will we get?" So I always told them, don't worry about surgical chances or cutting. Okay, you will get there eventually. There are many places, in fact, most places. Okay, so it's not something which you should be overly concerned about. The more you assist, so assist as much as possible. Doing surgeries yourself will eventually come when you're a third year postgraduate or when you're a first year senior resident. You will eventually get to learn. Okay, the learning curve may be longer for some, it may be shorter for some, but eventually everyone will get there. More important than surgical chances is decision making, and this I have seen in many institutes where I've worked, many medical colleges I've worked, I've realized that decision making is so much more important than knowing how to cut. Okay, so there's no point doing knowing how to do a very neat and clean cesarean section if you don't know whether the indication for you doing that surgery was correct or wrong. Okay, so there's you need to know, for this patient, should I operate or when to operate is more important than knowing how to operate. This is my opinion, and it is many senior surgeons' opinion. Knowing when to take the patient for surgery is so important. And sadly, most residents I meet lack this knowledge. So, knowing when to do what is the most important thing you need to learn as a postgraduate. What did I do during my learning phase? I made lots and lots of mistakes. I will not tell them here because some of them are quite embarrassing. But yes, I made lots and lots of mistakes, and those mistakes are so clearly etched in my mind that I will never ever make those mistakes again. Okay, so learn from your mistakes. You will make mistakes, you will make blunders, you'll make multiple blunders. But the important thing is it's okay to make a blunder, but don't repeat the blunder again. Learn from your mistake. Okay, very important. Document, very important. This you will help you in the long run. Whatever you're doing, whatever you're talking to the patient, whatever consent you're taking, whatever procedure you're doing, whatever has been done, document. Very, very important. What was my method of study as a postgraduate? So I'll tell you my method of study that may help you. So, for example, if I'm reading hypertension in pregnancy, I know it's given well in some books. So, what is my method of study? My method of study. So, what is my method of study? I'll tell you what I used to do, and I think it was very helpful, very beneficial. So, for example, if I'm studying hypertension in pregnancy, so I would do a bit of research, ask my seniors, ask my colleagues, or read myself and gather the good books. Say Williams gives it well, and Sweet gives it well, and a few more uh, uh, important papers like the CLASP trial. or the magpie trial for eclampsia. These are trials which you should know. So you can ask around, find out what is your, so, and then I would get everything photocopied. I may have Williams with me, but I would still photocopy the chapter, add on whatever important journals research or um, uh, important clinical teaching, make my own notes. Everything I would make into a small booklet, get it spiral bound, and label it as hypertension and pregnancy. So whenever I would read next, I would know everything is given in that book. I did the same for every topic: hypertension, diabetes, epilepsy in pregnancy, uh, cancer cervix screening. So every topic, I made small booklets where I had photocopied everything and kept it together, so that whenever I had to now revise, I had everything in one place. I wouldn't go looking here and there for every book. Okay, so that made a lot of sense. A lot of my friends got started doing the same thing, or would get my notes xeroxed, and it became sort of a trend. So this was my method of study. It really helped. Believe me, gathering the information took time. Okay, but once it's there in place, then you have everything. And suppose, say, after you've made your small booklet on hypertension, maybe after 2 months you find another interesting thing, just simply add that to the booklet. Okay, so it just adds on and you have everything in one place. It's very useful. Believe me, this was how I studied. Okay. Another important point which I did was find a partner. So me and my friend, we would sit together at the end of the day, or whenever we were free from her posting and I was free from my posting. It may not have been every day, but at least 2 to 3 times a week, we would sit together and we would discuss. If I had read something, I would tell her, and if she had read something, she would tell me. So by reiterating, by revising, by discussing with a friend or friends, that point gets re-emphasized, and she may have seen something interesting about that topic, and she would tell me. So it just adds on. Okay, so keep discussing. That's very important. Don't get jealous. Your friend may have done 10 cesareans, you would have just done two. Eventually you will get there. Okay, so don't get jealous. Very important. These small things get to you, they spoil your mood, they irritate you, and then you don't feel like doing anything. So don't get jealous. Very importantly, find time for yourself. For all the girls out there, go to the salon at least once a week. Pamper yourself. Okay, so find time for yourself, find time for your family, go shopping, go out, spend time with your family. That's very important. Okay, so to end, medicines cure disease, but only doctors cure patients. And the aim of this class is to help you realize what it takes to become a good doctor. I hope this helped. If you have any doubts, please, or queries or comments, please write them down in the comment section.